Hi guys, hope you're having a good day. My name is Angela and I would like to share my experiences with you today of my experience with electroconvulsive shock therapy or ECT, shock treatment. Um, I just wanted to say a disclaimer, I say a lot, so please bear with me on that. I have had major depressive disorder since 1994. I have been admitted to many psychiatric facilities for this and had been and have been on loads of different types of antidepressants, which have um, been with either little success or failed to improve my depression completely. In 2006, I was going through another bout of depression and I was about to try a new psychiatrist. I went to his office and it was at a hospital, and he took the normal history, asked me, how you feeling, blah blah blah. Um, Asked the history of like what I'd been on and stuff and all that, and basically he said to me, "Well, it sounds to me like you might be suffering from treatment-resistant depression," which, and he explained what that was to me was that either the medications, just basically failed to heal my depression. So he says we have other methods we can try for that, and we can look into that. He said, but I'd like to admit you to the hospital. I said, oh, okay. So anyway, I was admitted, and the next day I was set up with the head psychiatrist there, and it turns out that they, their main, what am I trying to say? The main thing that they did at the hospital was electric shock therapy. So he said, have you ever tried this, ever looked into this before? And I said, no, I didn't really know much about it except for watching like One Flew Over the Cuckoo's Nest or something and seeing the experiences with that and how horrible it looked. And so I immediately had like my guard up about it. But he explained, well, it's been proved a lot over the years, blah, blah, blah. And he explained basically what they do is that they put you out and that they give you something to relax your muscles, and that they basically induce a brain seizure. Later I found out it's a brain coma is what it is. But, and, they give you the electric current and stuff, and you come out in about 5 minutes, and he said, 95 or 96% success rate of this, and your depression should go all the way, blah, blah, blah. And he said one thing that it does do, though, is it affects your memory. He says that what it usually would do is it would affect your memory from about like 4 to 6 weeks before you've had the treatment. So you can't remember what that time period then, and then about 4 or 6 weeks after your treatment. So he said about a 3-month difference or something, or time sequence in your life where you won't remember hardly anything. And I thought, well, I could live with that, if it would make me feel better. And I just wanted to say, any of you who've suffered from horrible treatment or uncurable, horrible depression, unrelentless, it's like you're willing to listen to anything that sounds like it's actually going to help, So I was very eager about it. He says, well, I want you to watch a short video explaining it, and I also would like, you have to sign a consent form. He said, but I also would like to get at least a verbal consent or approval from a family member if you have one around. And so I said, well, you can talk to my dad about it. So anyway, I called my dad that day and told him I was in the hospital and told him what they want to do. And he said, oh God, Angela, he said, no, please don't do that. He said, this sounds horrible. He goes, do you know what they do to you? And he said, and I just kind of, basically said it the way he did, like, well, they just put you out, it's all improved, and then he said, no, please don't do it. And I said, well, can the doctor at least call you and talk to you about it? And he goes, oh, all right. So the next day, I guess the doctor talked to him, and I don't know what he said, because when I called my dad back, he goes, oh, it sounds wonderful. He said, go ahead and do it. It sounds like a great thing, So we set it up. It was something he wanted me to do basically as an inpatient. So he said I'd be doing it like every other day in the hospital. And I just wanted to mention that this particular hospital, like I said, does mainly electric shock. That's pretty much what they do. So when I went into the operating room or theater, I always call them theaters, like they do in London, where they do actually do this. When I went in for the nurse and they do the prep and all that, and I heard like people screaming. Honest to God, I heard people like screaming and crying, and then like other people, like a nurse or someone yelling at them or saying, "Wake up, John," or whatever the patient's name was. "You've just finished your ECT treatment," And then these people are like moaning and crying, and they were just like rolling them in and out one after the other. So when I was my time to go, I went in there, and the only thing I really remember is them sticking something in my mouth, and I think that was so you won't swallow your tongue or whatever, like epileptic or whatever. But also, I did want to say that he said, well, it'll only take a few minutes and you'll be up and around in no time or whatever. And like, boom, I was out. I just wanted to say, though, anyone who's ever had like anesthesia in a hospital or anything like that, the nice thing about that is usually in these clinics, what they'll do is they will kind of give you some kind of sedative to kind of ease you into putting you out, so it's not like boom like that. Well, with this, every time I did this, it was just like boom, I was out. So I have a horrible fear of anesthesia, after that, but that's a side note. But anyway, so the only thing I really kind of remember while I was in that hospital was a lot of pain as far as like headaches. I was getting a lot of headaches and stuff. But they put me in like group therapy there, and and it's like I was in no shape at all to function at all, to talk to anybody. I was like lights out, nobody was home completely. And after like 2 weeks, they released me. I've had about 14 of these treatments altogether, but after like 2 weeks, they released me, I think. And then I was sent back home. I was living with my mom, and she said that I would be like just walking around the yard like I didn't know where I was going or where I was at or anything, And she also said that what they had to do then is the rest of the treatments, I don't remember how many I had when I was in the hospital, but the rest were outpatient, and so the whole thing was like 4 weeks, maybe 5, I don't know. But I think like 2 or 3 of those weeks were outpatient, and I remember just having to arrange rides and because you can't drive at all with this. But I still have numbers in my phone that I don't know where I got this number, who these people are, but they must have told me at one time they would give me a ride to this or something. But one time my mom told me that before one of these treatments, I was like crying and pleading with her, like, please don't let me go through with this again. I said, it hurts. And, years later she told me about this, and I was wondering what else hurt, and I can't remember, but she said that I was complaining that it physically hurt. And it wasn't just the headache. Something else must have happened. I don't know. But I want to kind of wrap this up here. But basically what I want to say is that what they give you, it's not really a muscle relaxant. It's called succinylcholine. It's an actual paralytic to paralyze your muscles, basically. So, like in the old days, they didn't give anybody anything, and people would actually break bones and lose teeth, because this. So they gave you that along with the short-acting anesthesia, which is propofol. And so I've been a composer for many, many years, and a musician. I just want to say the long-term effects I've had is have permanent memory loss, and it's not just wasn't that during that duration that they would say that he said it would be like the 3 months or whatever. This is going on, ever since then. There've just been times in my life recently and over the years after this that I've just completely had like blackout times where I don't remember what happened or anything. People have to remind me what happened. Um, oh, and it did fail to relieve my depression too. That's another thing. It did not even work. So after I was released from treatment after the 14 sessions, the ironic thing is he ended up putting me back on antidepressants anyway. So I still have the depression. It's not as bad anymore, but so it didn't even work. But one thing it has not affected though is my musical memory as far as being able to play music. I'm a musician and be able to learn music and stuff. I'm still able to do that, but I was also used to compose, and I have not been able to compose anything since that, back in 2006. So it's like nothing comes out. It's really hard to explain. It's just like a zone. And I went back to college back in 2012, and during another horrible depression too, but also my memory was so bad that I was actually failing 5 out of my 6 classes. So I ended up having to drop them and just keep one class. And that had never happened to me. I was always an A and B student as far as college. So basically, I just kind of want to give a little background of what happened to me with it. Now, maybe you've had good experience with it, or if you're thinking about it, maybe it would work for you and maybe you wouldn't have this. A lot of people have improved depression-wise from it, and they don't care that their memory's affected, but I just know that there's not a lot of information out there about the long-term effects of memory loss, not just that short time that we're talking about. So, that's basically just what I wanted to say, so I appreciate y'all listening. Thanks.